Hello, nursing students. Today we are covering Chapter 12 from Anatomy, Physiology. This is the second edition F.A. Davis book called Understanding Anatomy and Physiology. We're studying the endocrine system, and I am on page, there's no page number, I'm on page 229. The endocrine system consists of a variety of glands and specialized cells throughout the body. These glands and cells secrete chemicals called hormones that influence almost every cell and organ in the body. Hormones determine, among other things, when you feel hungry or full, whether you're fat or thin, how you handle stress, and even how you sleep. The endocrine and nervous systems often work hand in hand to promote communication between cells, allowing them to coordinate and integrate their activities. Although they share a common goal, homeostasis, their methods for accomplishing this vary. For example, the nervous system uses lightning-fast electrical signals to communicate, making it the ideal choice to oversee such time-sensitive processes as breathing and movement. In contrast, the endocrine system communicates with slower-acting hormones, placing it in charge of body processes that happen more slowly, such as cell growth. The fast fact on this page states the study of the endocrine system and the diagnosis and treatment of its disorders is called endocrinology. So now I'm on page 230. The endocrine system consists of the glands shown in the figure on the previous page, which is this one, as well as clusters of hormone-secreting cells in various organs, including the brain, heart, and small intestine. The body at work. Endocrine glands are ductless glands. They secrete hormones directly into the bloodstream. In contrast, exocrine glands secrete hormones into ducts, which in turn lead to a surface in some other location, such as the body's surface, as in sweat glands, or the digestive tract, as in digestive enzymes. Once in the bloodstream, each hormone travels throughout the body. In the process, the cells of many different organs are exposed to a particular hormone. However, only cells having receptors for that hormone, called target cells, will respond. In other words, a hormone acts only on cells with receptors specific to that hormone. This is called specificity. Fast fact. Even after a stimulus ceases, the effects of the endocrine system can persist for days or even weeks. Comparison of the endocrine and nervous systems. The actions of the endocrine and nervous systems complement one another to ensure that the body maintains homeostasis. Their methods of action differ, though, as detailed below. So the endocrine system employs hormones to relay messages. It distributes hormones throughout the body via the bloodstream, and it responds slowly to stimuli, from seconds to days. It exerts long-lasting effects, and it adapts slowly to continual stimulation. So it's not something that's going to happen instantaneously, whereas with the nervous system employs neurotransmitters to relay messages. It secretes neurotransmitters into tiny spaces of a synapse, and it responds quickly to stimuli, like in milliseconds. So I think seconds are fast compared to weeks, but actually, compared to milliseconds, seconds are not fast. So the nervous system exerts short-lived effects, and it adapts quickly to continual stimulation. There's a box on this page that says that makes sense. Let me see if I can show it. There it is, right down there. That makes sense. To differentiate between endocrine and exocrine glands, remember, exocrine glands have exit routes or ducts to an environment that it's external to themselves, and endocrine glands secrete hormones in the body that end up in the bloodstream. So that's a great way to try to remember this. Hormones can be classified as steroid or non-steroid. Steroid hormones are synthesized from cholesterol. They include male and female sex hormones, as well as aldosterone, which is secreted by the adrenal cortex. Non-steroid or protein-based hormones are synthesized from amino acids. They can be further divided into protein hormones, such as insulin, peptide hormones, such as antidiuretic hormones, or amino acid derivative hormones, such as epinephrine and norepinephrine. Regardless of classification, hormones travel through the bloodstream to stimulate specific target cells. The target cells may lie anywhere in the body, close to the gland or far from it. Once a hormone reaches the target cell, it binds with a receptor to trigger changes within the cell. How this occurs, though, depends upon whether the hormone is a steroid or a protein-based hormone. Steroid hormones, which are derived from cholesterol, a lipid, pass easily through a cell's membrane. So that's what they're showing here. Once inside the cell, they bind to receptors in the nucleus associated with the DNA, and this triggers the synthesis of new proteins, which then alters metabolism in the cell. Protein-based hormones can't penetrate the cell wall. Consequently, they bind to receptors on the cell surface. The binding of the hormone activates a second messenger system, a cascade of processes that results in the production of a second messenger, which you see here. The second messenger activates specific enzymes, and the enzymes influence cellular reactions, producing the cell's response to the hormone. And there's another fast fact here. The body employs a number of second messenger molecules. However, the most prominent may be cyclic adenosine monophosphate, or CAMP, the body at work. The more receptors a target cell has, the more sensitive it will be to a hormone. Likewise, the fewer the receptors, the less sensitive it will be. Cells constantly create new receptors to replace older ones. Furthermore, cells can add to their receptors, making them more sensitive to a hormone. As an example, during the final stage of pregnancy, cells in the uterus increase their receptors for oxytocin, the hormone responsible for triggering uterine contractions during childbirth. Okay, here's a question. Which is a characteristic of endocrine glands? They employ neurotransmitters to relay messages. Their ducts carry their secretions to the body's surface. We know that's not correct. They will exert a long-lasting effect. Yes. They respond quickly to stimuli. No. And they don't employ neurotransmitters. They employ hormones. So the answer is C. They exert a long-lasting effect. The endocrine system releases hormones to the bloodstream, not the body surface. Okay, so now we're going to talk about the pituitary and the hypothalamus. The pituitary gland, especially in conjunction with the nearby hypothalamus, exerts more influence on body processes than any other endocrine gland. And that's why it's called the master gland. The tiny pea-sized pituitary gland sits just underneath the hypothalamus. There's hypothalamus, there's pituitary gland. It lies cradled in the sella turcica, a cavity within the sphenoid bone. So you can see that the bone completely wraps around the pituitary gland. It's very hard to get at that in the event that there is a tumor growing on the pituitary gland. So that when they talk about inoperable brain tumors, you can see why it might be difficult to operate on one in the pituitary gland, because it's so surrounded by all this bone here. A stalk called the fundibulum. And fundibulum connects the hypothalamus and the pituitary stalk. So this is actually pointed the wrong place. Let me see if I can move that. There it is. How about that? That's where it is. Despite its small size, the pituitary gland is actually two distinct glands. The anterior, which is on towards the front of it, or the adenohypophysis, and the posterior pituitary, or the neurohypophysis. These two glands are made of different tissue, excited by different types of stimuli, and they secrete different hormones. The anterior, look at all that, okay. Pituitary, the larger of the two pituitary glands, consists of glandular tissue. It synthesizes and secretes a number of very important hormones, all under the direction of the hypothalamus. Neurons within the hypothalamus synthesize various hormones. Some, called releasing hormones, stimulate the anterior pituitary to secrete its hormones. Others, called inhibiting hormones, suppress the hormone secretion by the anterior pituitary. The neurons of the hypothalamus release their hormones into a system of blood vessels called the hypophyseal portal system, which is here. These little yellow with the red dots. This is on page 232. You can see it right down there. There we go. The neurons of the hypothalamus release into the hypophyseal portal system. The blood travels straight to the anterior pituitary, where the hormones from the hypothalamus act on target cells in the anterior pituitary. And this stimulates the anterior pituitary to release or to suppress the release of certain hormones into general circulation. I guess we're going to talk about the hormones of the anterior pituitary. I'll go ahead. Well, those are all the hormones released by the hypothalamus. You've got the gonadotropin releasing, the thyrotropin releasing, the corticotropin releasing hormone, the prolactin releasing hormone, also the prolactin inhibiting hormone, and then the growth releasing hormone. Those are all released by the hypothalamus to the pituitary gland. All right, so we're going to talk about the anterior pituitary, which is the front, okay, of the gland. Most of the hormones produced and secreted by the anterior pituitary are tropic or trophic hormones, so called because the hormone names end with the suffix tropin or tropic, such as gonadotropin, thyrotropin, etc. Tropic hormones stimulate other endocrine cells to release their hormones, as shown in the illustration. This is showing the thyroid stimulating hormone, or thyrotropin, stimulates the thyroid gland to release thyroid hormone. The prolactin stimulates milk production in the mammary glands in females. In males, it may make the testes more sensitive to LH, which is luteinizing hormone. You'll see that over here. Luteinizing hormone, LH, a gonadotropin, stimulates ovulation and estrogen and progesterone synthesis in females, and the secretion of testosterone by the testes in males. Growth hormone, or somatotropin, acts on the entire body to promote protein synthesis, lipid and carbohydrate metabolism, and bone and skeletal muscle growth. Adenocorticotropic hormone, ACTH, stimulates the adrenal cortex to secrete corticosteroids. And then the follicle stimulating hormone, FSH, one of the gonadotropins, stimulates the production of eggs in the ovaries of females and sperm in the testes of males. So vital to our reproduction of our species there. So there's a life lesson here about growth hormone abnormalities. The secretion of too much growth hormone, which would be hypersecretion, during a child's growth years will trigger rapid excessive skeletal growth, resulting in a condition called gigantism. If the epiphyseal plates have already fused when the hypersecretion occurs, cartilage will form new bone, causing the hands, feet, face, and jaw to enlarge, a disorder called acromegaly. In contrast, a deficiency of growth hormone, hyposecretion, while a child is still growing, will result in stunted growth. This is sometimes called pituitary dwarfism. The condition is usually treated with growth hormone injections. Okay, the body at work. The following are some of the important hormones released by the hypothalamus, which was back on this one. Each acts on the anterior pituitary to release or suppress a particular hormone. For example, thyrotropin-releasing hormone stimulates the anterior pituitary to release thyrotropin, also called TSH, or thyroid-stimulating hormone. In turn, this hormone stimulates the thyroid to secrete thyroid hormone, or TH. The gonadotropin-releasing hormone promotes secretion of FSH and LH. The thyrotropin-releasing hormone promotes the secretion of TSH. Corticotropin-releasing hormone promotes the secretion of adrenocorticotropic hormone, ACTH. Prolactin-releasing hormone promotes the secretion of prolactin. And then, of course, a prolactin-inhibiting hormone inhibits the secretion of prolactin. Growth hormone-releasing hormone promotes the secretion of growth hormone. Okay, the next page is the posterior pituitary gland. This is page 234. Unlike the anterior pituitary, which is composed of glandular tissue, the posterior pituitary is made of neural tissue, which to me explains why it's smaller, because nerves are so tiny, and glands have to physically, their physical size is going to determine how much hormone can be secreted. So, it makes sense that you need all these like tube structures that are going to be larger than something that's just a neuro signal. So also, instead of synthesizing hormones as the anterior pituitary does, the posterior pituitary simply stores hormones synthesized by the hypothalamus. The hormones stored by the posterior pituitary are antidiuretic hormone, ADH, and oxytocin. Okay, so the nerve fibers that form the posterior pituitary originate in the hypothalamus, as shown here. The hypothalamic neurons synthesize the hormones, which they send down to the pituitary to be stored. The posterior pituitary to be stored. The posterior pituitary holds the hormones until stimulated by the nervous system to release them. Okay, so these are going to be released. They can be stored until the nervous system says we need them. So you've got oxytocin, which stimulates contraction of the uterus during childbirth, and it also triggers the release of milk from the breasts during lactation. Antidiuretic hormone, ADH, acts on the kidneys to reduce urine volume and also prevent dehydration. ADH is also called vasopressin, and ADH we discussed more in depth in Chapter 18, the urinary system. So, here's a question. A key difference between the anterior and posterior pituitary is that the posterior pituitary, A, consists of glandular tissue. Nope, that would be the anterior, has glandular tissue. It secretes hormones under the direction of the hypothalamus. It receives hormones from the hypothalamus via the hypophyseal portal system. That is also the anterior, not the pituitary. So actually, yeah, it does not secrete hormones under the direction of the hypothalamus either, but it stores hormones that are released from the hypothalamus. Okay, but doesn't it also, okay, no, that's right, because it's not going to secrete those until it receives neurotransmitters. So it's definitely D. Control of the pituitary secretions. This is on page 235. The pituitary gland does not release a steady flow of hormones. Rather, it releases hormones in phases or pulses. For example, growth hormone is mainly secreted at night, whereas LH, luteinizing hormone, surges in the middle of the menstrual cycle. The central nervous system plays a role in controlling hormone secretion. So too do the target organs themselves through the process of negative feedback. Control by the central nervous system. The brain constantly monitors conditions both inside and outside the body. In turn, it triggers the release of hormones as needed. For example, when it's cold, it triggers the release of TSH to promote body heat. After a hearty meal, it stimulates the secretion of GH to break down fats for energy and use amino acids to build tissue. Control by negative feedback. When the pituitary stimulates another endocrine gland to secrete its hormone, that hormone is then fed back to the pituitary, telling it to stop further release of the tropic hormone. This process is called negative feedback. Negative feedback loops are used extensively to regulate hormones in the hypothalamic pituitary axis. The following figure illustrates the negative feedback process as it relates to the regulation of. I just covered this page, and this is the figure that it was talking about. It actually does have an animation. It's showing that cold stimulates the hypothalamus to release TRH. Okay, then the TRH stimulates the anterior pituitary to release TSH. The TSH stimulates, a lot of stimulation going on. TSH then stimulates the thyroid to release the thyroid hormones. So at the same time, the increased thyroid hormone inhibits the release of the TSH by the pituitary. So as soon as this starts getting released, it goes back and says, okay, you can stop now. And the hormone that is released will stimulate metabolism, increasing warmth. So the use of negative feedback to control hormone secretion, combined with the fact that hormones have a limited lifespan, causes most hormones to be secreted in pulses, because as soon as you let it out, some of it's circulating, but some of it's also going back to say, okay, stop, we got it, we got enough now. So that's why it's pulses. And then when it has to wait until it receives some more stimulation for it to then release more, which is also going to make it stop right after that. So the next gland we will study is the pineal gland. Here we go. We already answered that one. So here's the pineal gland, which is way over here, this little blue pea. The pineal gland produces melatonin, a hormone that rises at night when sunlight is absent and falls during the day. High melatonin levels trigger sleepiness, making it a key factor in the sleep-wake cycle. Although yet to be proven, scientists speculate that the pineal gland may also regulate the timing of puberty. So, another opportunity for our kids to become scientists and figure this stuff out. So, the pineal gland is tucked in the center of the brain on the roof of the brain's third ventricle is the tiny cone-shaped pineal gland, which is showing right there. Fast fact, a number of people take supplemental melatonin orally to combat jet lag or other sleep disorders. And while the supplements are generally regarded as safe for short-term use, taking too much can increase one's risk for blood clots and seizures. And there's a life lesson here about seasonal affective disorder. Low levels of melatonin have been linked to mood disorders, particularly seasonal affective disorder, or SAD. Occurring during winter months when exposure to sunlight is limited, people with SAD complain of sleepiness, depression, irritability, and carbohydrate cravings. Exposure to special high-intensity lights for several hours each day often relieves symptoms. The thymus. So back to our slides. The thymus secretes thymosin and thymopoietin, two hormones having a role in the development of the immune system. Although it secretes hormones, making it a member of the endocrine system, the actions of the hormones make the thymus part of the immune system. For more information on the thymus gland, see Chapter 16, Lymphatic and Immune Systems. So the thymus lies in the mediastinum, just beneath the sternum. So they're not showing the sternum here, but I believe the sternum is protecting the thymus. In children, the thymus gland is large. Beginning in puberty, though, the gland starts to shrink, and by the time one reaches old age, the gland consists mostly of fat and fibrous tissue. Okay, so the next gland we will discuss is on page 237, the thyroid gland. And I wrote in my book that this is the biggest gland with an exclamation point. So the largest endocrine gland, the thyroid, consists of two large lobes connected by a narrow band of tissue called the isthmus, which is right there in the middle. The thyroid gland resides in the neck, just below the trachea, where it is wrapped around the anterior and lateral portions of the trachea. Thyroid tissue is made of tiny sacs called thyroid follicles. Unlike other glands, the thyroid gland can store hormones for later use. Cells between the thyroid follicles, called parafollicular cells, secrete another hormone called calcitonin. Secreted in response to rising blood calcium levels, calcitonin triggers the deposition of calcitonin in bone, thus promoting bone formation. The effects of calcitonin are particularly important in children. The body at work. As previously described, TSH released from the anterior pituitary stimulates the release of thyroid hormone, TH, from the thyroid gland. The overall effect of TH is to increase the body's metabolic rate, which in turn increases heat production. This explains why TH is released when the body is exposed to cold. Just a few of the other effects of TH are increased rate and strength of heart contractions, increased respiratory rate, and increased appetite. TH is also crucial for growth and development. It promotes the development of the bone, the nervous system, and skin, hair, nails, and teeth. Fast fact: the abbreviations T3 and T4 refer to the number of iodine atoms in each hormone. T3 has 3 iodine atoms, while T4 has 4. Thyroid disorders. Life lesson. A number of significant disorders develop from hyper or hyposecretion of thyroid hormone. If a child is born without a thyroid gland, the lack of thyroid hormone leads to cretinism, a condition characterized by retarded growth and sexual development, a low metabolic rate, and mental retardation. If the hyposecretion develops later in life, a lowered metabolic rate causes weight gain, hair loss, and fatigue. If hypothyroidism is severe or prolonged, a condition called myxedema may result, which involves swelling and firmness of the skin. Hypersecretion of TH stimulates the body's metabolism, resulting in a condition called Graves' disease. Thought to be due to an autoimmune disorder, which here's another thing the scientists don't know yet. We got to figure this out. Is what we think. It's thought to be due to an autoimmune disorder. Graves' disease causes unexplained weight loss, increased heart rate, nervousness, and exophthalmos, a protrusion of the eyeballs due to swelling of tissue behind the eye, like bug eyes. An enlarged thyroid gland due to a dietary deficiency of iodine is called simple goiter. Iodine is the basis for TH. Without enough iodine, the production of TH falls. Consequently, the anterior pituitary never receives a negative feedback message to stop producing TSH. Not only that, because the TH levels are low, the anterior pituitary tries to stimulate the thyroid even more by secreting greater levels of TSH. Instead of triggering the production of TH, which the thyroid can't do without enough iodine, the TSH stimulates growth of thyroid tissue, leading to thyroid enlargement and goiter. So it's very simple to prevent that from happening by including iodine in the diet, which is why you'll find iodine available in many types of salts out there. Okay, let's talk about the parathyroid glands now. They're really tiny. They look like candy stuck on the back of this thyroid gland. Located on the posterior surface of the thyroid are 4 parathyroid glands. These glands secrete parathyroid hormone, PTH, in response to low levels of calcium. The parathyroid glands are embedded in the posterior lobes of the thyroid. Most people have 4, but the number of glands as well as their location can vary. Fast fact: the margin of safety for blood calcium levels is so narrow that a drop in blood calcium levels as small as 1% causes the secretion of PTH to double. PTH is the main hormone the body uses to maintain normal levels of calcium in the blood. Normal nerve and muscle function, blood clotting, cell membrane permeability, and the function of certain enzymes all depend on adequate levels of calcium. We'll talk about calcium. In an effort to achieve calcium homeostasis, PTH exerts its influence on the bones, kidneys, and intestines. So PTH inhibits new bone formation while stimulating the breakdown of old bone, causing calcium and phosphate, because they stay together, to move out of the bone and into the blood. Well, you know what? I don't know about you, but I kind of like to have calcium in my bones. because it makes him strong. So you can see where that could be a problem. On the other hand, you gotta have the right levels of calcium in your blood, otherwise your heart won't work. So it's a balance. PTH encourages the kidneys to reabsorb calcium, blocking its excretion into urine, while promoting the secretion of phosphate. PTH also prompts the kidneys to activate vitamin D, necessary for the intestinal absorption of calcium. After its activation by the kidneys, vitamin D allows the intestines to absorb calcium from food. The calcium is transported through intestinal cells and into the blood. Fast fact, 99% of the body's calcium is found in the bones. Calcium homeostasis. Calcitonin, secreted by the thyroid, has antagonistic effects on the PTH. The interaction of these two hormones helps the body achieve calcium homeostasis. Which endocrine gland has a role in the immune system? So there was one that we talked about earlier that is in both the lymphatic and the immune system, and they said it was the thymus. If you remember that, let's see. Yep, it's A, the thymus, because hormones secreted by the thymus have a role in development of the immune system, making it part of both the immune and endocrine systems. And the other glands are not in the immune system, the thyroid, pineal, and pituitary. Back to some calcium abnormalities. On page 240, life lesson, calcium abnormalities. Calcium ions normally contribute to the difference in polarity across the cell membrane, the outer surface of the membrane having a positive charge and the interior having a negative charge. When calcium is in short supply, the charge difference lessens, and sodium ions can more easily enter the cell. As was discussed in the last chapter, it's the inflow of sodium that excites nerve and muscle cells. So in a calcium deficiency, hypocalcemia, nerve and muscle cells become more excitable. This excessive excitation leads to muscle tremors, spasms, or tetany, the sustained contraction of a muscle. In fact, a cardinal sign of hypocalcemia is tetany of the hands and feet called carpal pedal spasm. As shown here, the muscles of the hands contract tightly, unable to relax. Similar contractions also occur in the feet. If calcium levels drop further, the muscles of the larynx can spasm enough to stop airflow. That's going to prevent you from breathing and end your life. When the blood contains too many calcium ions, hypercalcemia, the excess calcium ions bind to the cell's surface. Fewer sodium ions flow in and out, and the cell becomes less responsive, resulting in symptoms such as muscle weakness, sluggish reflexes, and in severe cases, cardiac arrest. We do check reflexes, and the reason we check them is to see how the calcium levels are. If they seem sluggish, there could be an issue. So tetany from hypocalcemia typically occurs following the accidental removal of the parathyroid glands during thyroid surgery. In the back, they're small, they're kind of, in different places, so you could see that a surgeon may accidentally remove them. On page 240, right here, this I actually have two asterisks. I don't know how to make this bigger. But I was trying to show this table here because I have two asterisks next to it. So I think that we have to know everything in this box, which is that the T3 and the T4 target most tissues, and they increase the rate of metabolism, which is our energy, how we burn off calories. Calcitonin, the target for calcitonin, which is produced by the thyroid, is going to be the bone. Okay, so that's going to increase the deposition of calcium in the bones, and that in turn will lower the calcium in your blood because that's where it's coming from. It's going to take it out of the blood and put it into the bones. So the parathyroid hormone, PTH, that will target bone and kidneys. So the parathyroid hormone will increase your blood levels by taking calcium out of your bones. It also will reduce the urinary excretion of the calcium, so you're not going to pee out calcium as much, so you can save it for later in your bones. And it increases the absorption of calcium by the intestine. That's also going to be good. So the next thing we're going to be covering is the adrenal glands, and this is on page 241. So the adrenal glands perch on top of each kidney. Instead of being one gland, though, each adrenal gland is actually two distinct glands. The inner portion, called the adrenal medulla, because it's in the middle, consists of modified neurons, and it functions as part of the sympathetic nervous system. The outer portion, called the adrenal cortex, is glandular tissue and secretes steroid hormones called corticosteroids. We know those help fight inflammation. So the adrenal medulla, again, remember that's in the inside, it's like in the middle. The adrenal medulla contains modified neurons called chromaffin cells that act as part of the sympathetic nervous system. These cells secrete catecholamines, specifically epinephrine and norepinephrine, in response to stimulation. So catecholamines prepare the body for physical activity by increasing the heart rate and blood pressure, stimulating circulation to the muscles, dilating the bronchioles to maximize blood flow to the areas needed for physical activity. They also inhibit digestion and urinary production. That way, you can work out without having to pee right away. And it allows your body to devote its energy towards your physical activity. The blood, it will boost glucose levels, that's a source of fuel, by breaking down glycogen into glucose, also called glycogenolysis, and converting fatty acids and amino acids into glucose, which is gluconeogenesis. So the adrenal cortex, that will be the outer section, consists of 3 layers of glandular tissue, which are shown below, or shown right here. So again, see how it's a hat shaped? So it's on top, it's on the outside. It's covering the cortex, which is in the middle, right? So, the middle is in the middle of the cortex there. The middle, adrenal medulla is the very middle. The adrenal cortex is this outer portion of it. So they do 2 different things. And the cortex, which is this outer band, is actually 3 layers, and that's broken down here. So the first layer is the zona glomerulosa. That's the outermost layer, and that's going to secrete mineral corticoids. The biggest section in the middle here is going to be the zona fasciculata. Fasciculata. That's the middle layer, and that's going to secrete glucocorticoids. The very bottom, the middle here, is the zona reticularis, and that is the innermost layer, and that is going to secrete sex steroids. So it kind of makes sense that the sex steroids are going to be really important. You're going to want them in the middle where they're safe, right? The innermost layer. Okay, so the classes of hormones secreted by the adrenal cortex, or the outside. We talked about there's 3 classes. You got the mineral corticoids, adrenocorticoids, which are from the outermost, then the glucocorticoids from the middle, and then the sex steroids. So the mineral corticoids, what are those? Well, the principal mineral corticoid is aldosterone. And aldosterone acts on the kidneys to promote sodium retention and potassium excretion. In turn, it also causes water retention. So that's aldosterone is going to help you to retain water. So on the glucocorticoids, the principal glucocorticoid is cortisol. Glucocorticoids help the body to adapt to stress and repair damaged tissue by stimulating the breakdown of fat and protein, converting fat and protein to glucose, and releasing fatty acids and glucose into the blood. They have an anti-inflammatory effect, which is nice. They also suppress the immune system if secreted over a long term, which is not good. Glucocorticoids are essential for maintaining normal blood pressure. So the other class that is secreted by the adrenal cortex in the innermost the most inner layer is the sex steroids. So sex steroids include a weak form of androgen that is converted to the more potent androgen, testosterone. The testes produce much more testosterone, making this an unimportant source of testosterone in men. Androgens stimulate the development of pubic and axillary hair and sustain sex drive in both sexes. The sex steroids also include small amounts of estrogen. Because the amount is small, it has little importance during the reproductive years. However, it is the only source of estrogen after menopause. It's nice to have that around. Okay. There's a fast fact that glucocorticoids affect nearly every cell in the body. So let's talk about adrenal disorders. Adrenal disorders on page 242, life lesson. Hypersecretion of cortisol from the adrenal gland results in a collection of symptoms called Cushing syndrome. Classic symptoms include moon face, a rounded face, and a buffalo hump, a hump between the shoulders resulting from a redistribution of body fat. Because excess cortisol also disrupts carbohydrate and protein metabolism, other symptoms include hyperglycemia, muscle weakness, and edema. The breakdown of protein causes muscle wasting and loss of bone mass, while retention of sodium in water leads to hypertension. The hypersecretion of adrenal androgens often accompanies Cushing syndrome. This results in premature puberty in children and the development of masculine characteristics, deepening voice, increased body hair, and the development of facial hair in women. Hyposecretion of mineral corticoids and glucocorticoids occurs in a disorder called Addison's disease, also called adrenal cortical insufficiency. Symptoms include loss of fluid and electrolytes, weakness, muscle wasting, dehydration, and weight loss. Without treatment, adrenal insufficiency is life-threatening. So there's a box on this page, 242, which covers the hormones of the adrenal glands. And I have two asterisks next to that, so I think we're supposed to know all of this in this box. So you need to know that the epinephrine and the norepinephrine are hormones from the adrenal medulla. They target most tissues, and the epinephrine enhances the effects of the sympathetic nervous system, and so does the norepinephrine. In the adrenal cortex, the hormones aldosterone, cortisol, adrenal, oh, I guess it's just those two, right? Oh, and the adrenal androgens and adrenal estrogens. Okay, so the aldosterone targets the kidneys, and that's going to promote sodium retention and potassium excretion, which leads to water retention. Cortisol is going to target most tissues, and it stimulates the breakdown of fat and protein and the conversion of fat and protein to glucose. It enhances tissue repair, it's anti-inflammatory, and in large amounts, it inhibits the immune system. Adrenal androgens and the adrenal estrogens target sex organs, and the androgens promote the growth of pubic and axillary hair, which would be in your armpits, as well as sex drive. And the estrogens, they think, are from this particular source. They think that it's physiologically insignificant, which if it was, I think the body would be doing it. But anyway, it sure does come in handy after menopause for women. So I think that they maybe become physiologically significant after menopause. That's what I'm hoping anyway. Okay, fast fact. So this is important now for our patients. Prolonged stress results in increased blood levels of cortisol, which in turn, if it goes on for a long time, it leads to immune system dysfunction. One reason this occurs is that high concentrations of cortisol cause lymphatic tissues to atrophy and the number of white blood cells to decline. So, as members of the healthcare staff in hospitals, they are now held responsible for infections that develop in the hospital. And as you can see, the level of stress that a patient is experiencing is oftentimes not in our control. And yet it can affect whether or not an infection develops under our care, because if their immune system is not functioning fully, then they won't be able to fight off things that normally they could. It can make people very vulnerable to infection and other issues. So we really have to be careful about that. So I'm going to read this life changes, the life lesson, changes with aging. So with age, some target tissues become less sensitive to their controlling hormone. The amount of hormone secreted may change also, and the hormone may be metabolized more slowly, because metabolism slows down as we age. Everything slows. Following are some common effects of age on the endocrine system. Okay, so the thyroid gland becomes more nodular, leading to a decrease in secretion of thyroid hormones and a decreased metabolism, because thyroid hormones control our metabolism. Changes in levels of parathyroid hormone may contribute to osteoporosis, because we know that the parathyroid is the one that controls calcium levels in the bone and blood. Cells become less sensitive to insulin after age 50, which leads to a gradual rise in fasting blood glucose levels, and secretion of growth hormone decreases. Obviously, as you age, you don't need to grow anymore as much, resulting in decreased muscle mass and an increase in fat storage. So it doesn't sound that fun, but I'm sure we can make the best of it. All right, let's talk about the pancreas. This is on page 243. The pancreas is somewhat unique in that it contains both endocrine and exocrine tissues. The vast majority of the pancreas acts as an exocrine gland, but a small percentage serves an important endocrine function. For more information on the role of pancreas as an exocrine gland, see chapter 20, the digestive system. Okay, so the pancreas lies just behind the stomach, with its head tucked in the curve of the beginning of the small intestine, the duodenum. and its tail reaching to the spleen. Fast fact, the pancreas contains 1 to 2 million pancreatic islets, and yet they constitute only about 2% of pancreatic tissue. Endocrine cells called acini secrete digestive enzymes into ducts that drain into the small intestine. Interspersed with the exocrine cells are clusters of endocrine cells. These cells, called pancreatic islets or the islets of Langerhans. The pancreatic islets contain several different types of cells, the main one being alpha cells, beta cells, and delta cells. Those are the three main ones. So the body at work, the body must constantly work to keep blood glucose levels steady. If the levels fall too low, cells won't have enough fuel. On the other hand, too much glucose will trigger disorders such as autoimmune disease or pancreatitis. Let's talk a little bit about those alpha cells, beta cells, and delta cells. Alpha cells, so they secrete the hormone glucagon. Between meals, when blood glucose levels fall, glucagon stimulates liver cells to convert glycogen into glucose and also convert fatty acids and amino acids into glucose. That's gluconeogenesis. And so the resulting glucose is released into the bloodstream, causing blood glucose levels to rise. So looking back at this, the glucagon stimulates liver cells. So we are assuming that the liver cells are functioning properly. Now, if you are an alcoholic, you have basically broken your liver and it is not going to be working well. There's other things also that will cause a reduced liver function. So the liver is very, very important to this because it does help us in between meals to make sure that our cells get all the sugar that they need to continue doing their jobs. So it'll convert glycogen into glucose, but it also converts fatty acids and amino acids into glucose. So it's really great when it's working. Now let's talk about the beta cells. Keep in mind, on my book, I have a star, an asterisk next to this. I have circled it, so this is very important. The beta cells from the pancreas, okay, the beta cells secrete the hormone insulin. After eating, the levels of glucose and amino acids in the blood rise because of the food, right? Insulin stimulates the cells to absorb both of these nutrients. And as they absorb the nutrients, the blood glucose levels will fall because it's going from the blood into the cells. And that's when everything is working well. So you need for the beta cells to be working so that insulin can be released. And so the insulin is going to stimulate the cells to absorb the nutrients. So it's very important. The last main type of cell in the pancreatic islets would be the delta cells. And the delta cells secrete somatostatin. That is a hormone that works within the pancreas to regulate the other endocrine cells. Specifically, it inhibits the release of both glucagon and insulin, and it also inhibits the release of growth hormone. The next page in the book is showing the regulation of blood glucose. All right, so this is all about diabetes. So here we go. So what they're showing. And there is an animation to go along with it, supposedly, but I'm not going to worry about that right now since the volume doesn't seem to work on it. But after eating food, okay, the blood glucose levels rise as glucose flows from the digestive tract into the bloodstream. The second thing is that those high glucose levels stimulate the beta cells of the pancreas to secrete insulin. So as soon as there's glucose in the bloodstream, the body says, oh, wait a minute, what are we going to do with the sugar? We got to be able to put it into the cells, so we're going to need insulin. So let's get the insulin out there also to go along with the glucose. So then the insulin triggers two reactions. So it stimulates the cells to take up more glucose, and it also causes the liver to take up glucose and to store it as glycogen. And that's how the body returns the glucose levels to normal after you eat. So some of it gets stored, a lot of it goes into the cells, and everything is cool that way. You can keep the levels just right. So, but when the glucose levels drop below a certain point, like say that you've skipped a meal, the alpha cells in the pancreas are going to secrete the glucagon, because you don't have food, you got to get the sugar from somewhere. So the glucagon is released, and then the glucagon, that will stimulate the liver, assuming it's working properly, to break down the stored glycogen into glucose, which then is released by the liver into the bloodstream. So this causes the blood glucose levels to rise. You talk about diabetes mellitus. Okay, one of the most common endocrine disorders, the incidence of diabetes in the United States continues to rise. According to the American Diabetes Association, over 29 million Americans, or 9.3% of the population, have diabetes. Of those, thousands experience serious complications. 810 people die, 230 undergo an amputation of a lower limb, 120 begin kidney dialysis or receive a kidney transplant, and 55 go blind each day. This is every single day. This is ridiculous. What's more, it's estimated that about 6 million of the people with diabetes don't even know they have the disease. And that's the problem. If you don't have symptoms, it's hard to remember to stay on, the treatment. But if you don't stay on it, it could have very serious consequences. So, diabetes results from an inadequate amount of insulin or from a diminished number of normal insulin receptors. Okay, so there's two different things, but either way, without enough insulin or without enough insulin receptors, the glucose cannot enter the cells. As a result, the cells are deprived of their main energy source, and glucose builds up in the blood, and this produces high levels of blood glucose, hyperglycemia, one of the cardinal signs of diabetes. High levels of blood glucose trigger a number of physiological changes that produce the classic signs of this disease. For example, the kidneys normally filter blood plasma and convert it to urine. As it does, it removes glucose and returns it to the bloodstream. In hyperglycemia, the high levels of glucose overwhelm the kidneys, and excess glucose spills over into the urine. Glycosuria. So that's one way. If we find glucose in the urine, which is probably fairly easy to test for, that's a sign of diabetes. To flush out this extra load of glucose, the kidneys produce more urine, polyuria. So you're going to have to pee all the time, which this dehydrates the body, triggering excessive thirst, polydipsia. Well, the more you drink, the more you're going to pee. That's the way it goes, right? So in addition to drinking excessive quantities of fluids, people with untreated diabetes also experience continuous hunger, polyphagia. And that's because even though the blood is carrying an overabundant supply of glucose, the cells are starving because the glucose can't enter it. So you're just going to keep eating more, but it can't get to where it needs to, and that's bad. So if left untreated, the body begins to burn protein and fat for energy because it doesn't have a choice if there's no glucose in the cells. It's got to burn something. Okay, so besides causing fatigue and weight loss, this abnormal metabolism produces an acidic byproduct called ketone bodies. As ketones accumulate, the blood pH drops, causing acidosis. Unchecked, this will progress to diabetic ketoacidosis, causing symptoms such as nausea, vomiting, fruity odor of the breath, and possibly coma and death. Diabetes also damages blood vessels, resulting in heart attacks, strokes, decreased circulation in the extremities, and even blindness from blood vessels that are damaged in the retina, as well as nerves, resulting in numbness and tingling. Kidney disease is another common complication because, man, your poor kidneys are working so hard for not, and it's not doing any good because the cells can't do their thing. So there are two main types of diabetes, type 1 and type 2. So the characteristics of each type are outlined in the table below. So, let's look at type 1. So that's going to happen before you turn 30, very rapid rate of onset. And it's a very low percentage, so it's only 10% of our diabetic patients. And the cause is a deficiency of insulin resulting from the destruction of beta cells of the pancreatic islets. So if you don't have any functional beta cells, you're not going to be getting the insulin that you need. And then, so the contributing factors aren't really clear. They think it may be an autoimmune disease. Another opportunity for our young scientists to figure this stuff out. But basically, because they don't have beta cells that work, they're going to need insulin from somewhere, and that's going to be from daily insulin injections. So this used to be called juvenile onset diabetes or insulin-dependent diabetes mellitus, IDDM. So just remember that the type 1 occurs before you're 30, when you're younger. It's a smaller number. It happens to younger people. The type 2 is usually after age 40. It's gradual, and it's actually 90% of our patients. And the cause of diabetes of this type 2 is not the inability to produce insulin, but rather it's the loss of insulin receptors on target cells. So it doesn't matter how much insulin you have, if there's no receptors for it, it's not going to do anything. So these target cells just don't have receptors in order to utilize the insulin. And some of the contributing factors would be heredity combined with excess body weight and sedentary lifestyle. And it's also more prevalent in Native Americans, Hispanics, and African Americans. And so again, so they're saying it's genetic. That's what heredity means. That so you may see it in certain races of people because it's in their genes. Lifestyle changes may control the disease, and if not, then oral diabetic medications or insulin injections may be used. So type 2 diabetes was formerly called maturity onset diabetes or non-insulin dependent diabetes mellitus because it can be controlled without insulin in some cases. And that makes sense. Routine screening for diabetes includes checking the urine for glucose and asking about the 3 polys. Polyuria, which is a lot of peeing, like I gotta go, oh, I gotta pee again, oh, I know I just peed, but I gotta pee again. Okay, that is way too much. So peeing a lot, polydipsia, what's polydipsia? I forgot what that one is. And polyphagia, which is eating a lot. So polydipsia is drinking a lot, right? Okay, that makes sense. Because if you drink a lot, guess what happens? Side effect, it's got to come out. What goes in's got to go out. So you're going to pee a lot if you're drinking a lot of anything. But this is going to cause you to be really thirsty, and it's going to cause you to be really hungry, and it's going to cause you to pee a lot. So to make sense of this, The names of the three polys, remember this. Poly is a prefix meaning much. And the suffix urea sounds like urine, so polyuria means much urine. The suffix phagia comes from the Greek word meaning eating. For example, dysphagia means difficulty eating, while polyphagia means excessive eating. Okay, the suffix dipsia comes from the Greek suffix meaning thirst. Think of taking a dip in a body of water, then make the connection to polydipsia, or drinking much water. So really thirsty, and that's going to make you pee a lot. So about 1 in 50 women develops diabetes during pregnancy, called gestational diabetes. And this form of diabetes usually disappears after the woman gives birth. Now, the book doesn't mention this, but when I was pregnant, I believe I was told that the reason it occurs during pregnancy is because as the baby grows in the uterus and everything expands, it presses on other organs and can affect their function. And in this case, I was told that it was because of the pancreas getting squished or moved out of the way by the baby, so it can't function as well. So every year, 1.6 million new cases of diabetes are diagnosed in people aged 20 years and older. So, cha-ching ching, man, think of all the money. If you were making a product for diabetic, you could be encouraged to know that there's a big market out there, because every year there's 1.6 million new potential customers for your product. So body at work. Diabetes damages both cardiovascular and nervous systems. And while experts remain unclear as to why this happens, hello young scientists, help us out here, it appears that chronic hyperglycemia triggers a metabolic reaction that damages cells in small and medium-sized blood vessels. So vascular walls become thicker, restricting blood flow. Nerves, which require an adequate supply of blood to function, are going to suffer ischemia, and then damage results. And I know that when I was working for Johnson & Johnson, doing some research, we found that in Japan, so possibly Asian populations, I think like 30% of them have diabetes, which as a cardiovascular engineer, I was designing products that would be inserted into the arteries. And so the arteries are clearly greatly affected by diabetes. And what we found is that, yeah, the vessels are smaller. They're also, there's a lot more curves and bends and stuff, which makes it more challenging for our devices to get through. Well, guess what? It's going to be more challenging for everything to get through. And hence this gradual onset. It's just like the slow deprivation of the adequate nutrients. So 60 to 70% of people with diabetes have some form of nerve damage. And nerve damage can occur anywhere in the body, although nerves in the legs and feet are most frequently affected. And guess what? Those are the ones furthest away from the heart. So the blood is going to get there last. So guess what? They're probably not going to get as much blood. That makes a lot of sense, okay? The resulting loss of sensation in these areas makes patients unaware of minor injuries, okay? So left untreated, these wounds can become infected and even gangrenous, often requiring amputation. So, for example, I've got a problem with one of my toes. It has very poor circulation, but I can't tell because when there's no circulation, there's no feeling. So it's not something obvious to me, but it's a big problem for my toe. So we do have to be careful about that and really watch that because of the nerve damage that we're going to see in more than half of these patients. All right, so the box down here talks about hormones of the pancreatic islets again. And so those hormones would be the glucagon, insulin, and the somatostatin. And the glucagon primarily targets the liver, so the liver needs to be working, and it's going to stimulate the breakdown of the stored form of glucose for release into the bloodstream. And then insulin, we know that targets most tissues because the cells need the glucose. And so the insulin stimulates the movement of glucose from the bloodstream into the cells, assuming the cells are ready to receive it. Somatostatin, that's going to target your pancreatic cells, and that's mainly to help regulate the secretion of the other hormones of the pancreas. Okay, now we're ready to move on to the gonads. This is the sex cells. This is where all the fun happens, right? Okay, so the gonads, the testes in the males, and the ovaries in females are the primary sex organs. They produce sex hormones, which stimulate the production of sperm in males and eggs in females. And they also influence the development of secondary sex characteristics during puberty. For further information, see Chapter 23, the reproductive system. So the cells of the ovarian follicle secrete estrogen, and estrogen promotes the development of the female characteristics, such as the breast development. And it also contributes to the development of the reproductive system. After ovulation, the corpus luteum, the tissue left behind after the rupture of a follicle during ovulation, secretes progesterone. And progesterone, in combination with estrogen, helps maintain the uterine lining during pregnancy. Then they're showing the testes here. Specialized cells within the testes secrete testosterone. And testosterone triggers the development of the male sexual characteristics, and it also sustains sperm production. Okay, this is the last slide, so I'm just going to read this one. The chief role of insulin is to stimulate the cells to take up glucose, to stimulate the liver to break down stored glycogen, to stimulate the pancreas to release glucagon. No, the pancreas does not release glucagon. Or to trigger the conversion of fatty acids and amino acids into glucose. And the answer is A, okay? Because glucagon stimulates the liver to break down stored glycogen into glucose, and declining blood glucose levels stimulate the pancreas to release the glucagon, and glucagon triggers the conversion of fatty acids and amino acids into glucose. So the insulin, the chief role is to stimulate the cells to take up the glucose. And again, the cells need to have the ability to take it as well, but the insulin is to stimulate them so they can take it up. And that's all the slides, but let me see if there's another. Okay, so then there's the key terms, but let me read this last section called Endocrine Cells and Chemicals on page 247. Not all hormones are secreted from specific well-defined glands. In fact, organs such as the heart, liver, kidneys, stomach, small intestines, and placenta contain clusters of cells that secrete hormones. Just a few examples, okay? This is important. So, as a nurse, we need to know this. When stretched by rising blood pressure, heart muscle cells secrete ANP, atrial natriuretic peptide, a hormone that triggers changes to lower the blood pressure. The placenta secretes estrogen, progesterone, and other hormones that help maintain a woman's pregnancy, and the stomach secretes several hormones that help regulate the digestive process. Also, realize that hormones and neurotransmitters are not the only chemical messengers in the body. Certain cells in the body secrete other chemicals that help regulate function. Perhaps the most significant of these is prostaglandins. Okay, made by cells throughout the body, prostaglandins are lipid molecules like hormones that integrate the activities of other cells. Unlike hormones, which are released into the bloodstream so that they can influence the activities of widely separated organs, prostaglandins are released within the tissue where they are produced. As a result, instead of influencing activities in distant organs, prostaglandins influence the activities of neighboring cells. And the body manufactures a multitude of different prostaglandins. The various prostaglandins play many roles. For example, some prostaglandins promote pain and fever, while others act as vasodilators and vasoconstrictors, or vasoconstrictors. They are also involved in inflammation, blood clotting, uterine contraction, reproduction, and digestion. And at the bottom of this page is the fast facts that say non-steroidal anti-inflammatory drugs, those are the NSAIDs, such as ibuprofen, relieve pain and fever by blocking the synthesis of certain prostaglandins. That's how those work. Okay, so now we are at the very end, and there's the test your knowledge, which does include answers,